First, I'm observing the environment for anything that can be an immediate hazard at any point of rendering care. I'm I'm not seeing anything that might cause falls and trips for me and my patient. Otherwise, it's safe for me to approach. Observing the 5 moments of hand hygiene, bare below elbows without accessories. I will clean my hands following the 6 steps, opening the taps, wetting my hands with warm water, applying antimicrobial soap, rubbing from palm to palm over dorsum, in between fingers, back of the fingers, rubbing both thumb, tips of the fingers, including both wrists, rinse thoroughly, and dry with disposable paper towel, and throw it to the normal waste bin and close the taps with my elbows. I'm proceeding to the patient, drawing the curtains to provide privacy and dignity, and do a quick hand hygiene and introduce myself. Hello, good morning. I'm Darren. I'm one of the nurses looking after for you today. Are you George Byrne? Yes. All right. How would you like me to call you? Now, Georgie, I'm here to do an assessment which will take around 10 to 15 minutes, and I'll be taking your blood pressure, pulse rate, respiration, temperature, and your oxygen saturation. And the rest of the time, I'll be asking some question related to your general health, so we can better plan for your care. Is that all right? Okay. Now to start with, I just need to verify your information. And can I check your ID band? And can you state your full name and your date of birth for me? And your hospital number is 123456. I'm saying it's the same with the documents that I have with me. And do you have any allergies with medication, food, latex rubbers, or any kinds of dressings? All right. And what was your reaction when you had some penicillin? All right. Now it's highlighted in your documents here, so we will not be giving you any of substances containing penicillin. All right. Now, are you comfortable? And do you feel any pain at the moment? And where do you feel the pain? Does the pain radiate to any part of your body? Is this a new or an old pain? Does the pain continuous or do you feel it even at rest? And how would you rate your pain according to the level? Is it mild, moderate, or severe? And did you have any medication? What do you think relieves your pain? How about sitting you comfortably in bed? Would that help your pain? All right. Anyway, I'll be checking for your prescription. All right. For any pain relief prescribed for you. Is that all right? Now, assessor, can I verify if there is pain relief prescribed for the patient? All right. Is the patient nil by mouth? All right. So, and I consider that the pain has been dealt with. All right. So, how are you now, Georgie? All right. So, would you be happy for me to proceed doing my assessment? Okay. Now, I'm doing my hand hygiene and maintaining privacy and dignity for the patient. I'm checking my equipment that is service within date. It is clean and safe for me to use. I'm choosing the appropriate adult cup for the patient. It should cover at least 80% of the upper arm circumference, and it should not be too tight or not too loose, and it should be 2 finger breadths um, above the fossa. And Georgie, you might feel a bit tightness when I turn the machine on, but that shouldn't hurt you. All right, it will take around 5 to uh, 10 to 15 seconds to take your blood pressure. That will roughly take 10 to 20 seconds to take your blood pressure. Okay. Now I'm also applying this probe into your opposite fingers. I'm checking it if it's dry, clean, and the capillary refill is good, and it's safe for me to use that there in that arm. And also I'll be checking for your temperature using tympanic thermometer. Did you have any do you have any hearing aid? Or did you have any surgery in your ears before? Have you been lying in this ear for a long time? Alright, so I'm checking, and I have the noted, and I will document, Georgie, if that's okay for you, I'll just document very quickly the findings that I have.